A simple gel applied directly, promising an erection in as little as 10 minutes. And it's available without a doctor's prescription. It sounds almost too good to be true, doesn't it? Today, Dr. Freya Parkar is going to talk about a very real product, a new FDA-authorized over-the-counter topical gel for ED called Aroxen. But Dr. Freya Parkar wants to be very clear from the start. This is not magic, and it is certainly not for everyone. In this video, Dr. Freya Parkar's job as a board-certified urologist is to help you separate the scientific fact from the marketing hype. Dr. Freya Parkar is going to explain what it is, how it works, how effective it really is, and most importantly, who should and who should not consider using it. If you're new here, hi, Dr. Freya Parkar, a urologist with over 15 years of experience helping men improve sexual health and confidence. But here's the catch. In the clinical studies, roughly 1 in 3 men didn't get a meaningful response, and correct application matters more than most guys realize. Stay with Dr. Freya Parkar because in this video, Dr. Freya Parkar will walk you through the candidate test to see if this gel will even work for you. And Dr. Freya Parkar will teach you the 15-second technique that prevents you from wasting $30 on a tube that does nothing. You do not want to miss that detail. But real quick, before we dive in, Dr. Freya Parkar wants to take a pulse on this. If the results were exactly the same, which would you prefer? A daily pill or a 10-minute gel? Type pill or GL in the comments below right now. Dr. Freya Parkar is curious to see what men actually prefer. Before we even discuss the gel, we need to understand a fundamental concept. Erectile dysfunction is rarely just a local issue. It's a systems issue. A healthy erection is a complex symphony that requires your brain, your hormones, healthy nerves, and above all, a healthy and responsive cardiovascular system. Your blood vessels need to be able to relax and open up on command. This is why Dr. Freya Parkar often refers to ED as the canary in the coal mine for men's cardiovascular health. It can be an early warning sign that something is amiss with your circulation. Please keep this in mind as we explore any treatment that addresses the symptom. So, what exactly is Aroxen? Practically, it's used on demand. It comes in a single-use tube. You apply the contents directly to the glands, the head of the penis, and gently rub for about 15 seconds. Then you wait for a unique physical effect, a rapid cooling sensation followed by a gradual warming. And this is where its mechanism of action is completely different from pills like tadalafils, Cialis, or sildenafil, Viagra. Those pills work systemically by inhibiting an enzyme called PD5 throughout your body. Here's the simple comparison. Pills work from the inside out through your bloodstream. This gel works from the outside in through local nerve stimulation. The cooling and warming effect stimulates the sensitive nerve endings in the glands. This sends a signal to your brain, which in turn triggers the local release of nitric oxide. As we've discussed, nitric oxide is the key molecule that tells blood vessels to relax, allowing blood to flow in. Important, it's not a switch that turns on erections by itself. Think of it as a primer. It helps your body respond when arousal is already there. So, the crucial question, does it actually work? Let's look at the data from the clinical trials. In the FDA-submitted studies, around 60 to 65% of men reported clinically meaningful improvement in their erectile function. And for those it worked for, the onset of action was fast, typically within 10 minutes. Now, how does that 65% figure compare? It is lower than the efficacy rates we see with prescription pills like tadalafil, which can be effective for up to 80% of men in some studies. However, the major trade-off and key advantage of Aroxen is its local action, speed, and fewer systemic side effects. So, the takeaway is this. Yes, it works, but it's not a 100% home run. The data suggests it is most effective for men with mild to moderate erectile dysfunction. It's a simple question Dr. Freya Parkar asks every patient. Do you still get morning erections or partial erections during masturbation? If the answer is yes, it means your nerve pathways are still intact. You pass the test, and this gel is a viable option for you to amplify that response. If the answer is no, meaning you haven't seen an erection in months or years, then your nerves or blood vessels may be too damaged for a topical gel to work alone. You would likely fail this treatment and require a deeper medical workup. So, Aroxen is a good option if you have mild to moderate ED, you desire a fast-acting solution, you cannot take oral pills due to heart conditions or nitrate medications, or you hate the side effects like headaches and flushing. It is likely not for you. If you have severe ED from advanced diabetes or vascular disease, your ED is hormonal, low testosterone, or psychological, you have sensitive skin or allergies to the ingredients. Safety note: avoid using it on broken or irritated skin and stop if you get significant burning, rash, or swelling. Please view ED not as a failure but as a check engine light for your body. Use this as motivation to check your blood pressure, cholesterol, and sleep habits. The gel manages the symptom, but your lifestyle manages the cause. And finally, before you go, Dr. Freya Parkar wants to teach you the 15-second technique so you don't waste your money. In clinical studies, about 1 in 3 men didn't get a meaningful response. So, correct application matters more than most guys realize. Dr. Freya Parkar is going to show you the exact 15-second application technique that gives this gel a fair shot. To make this work, you must massage the gel into the head of the penis for a full 15 seconds. Why? Because the gel creates the temperature change, but the friction from your fingers is what actually wakes up the nerves. Think of it like starting a fire. The gel is the fuel, but the 15-second massage is the spark. Without the friction, there is no signal to the brain and no erection. So set a timer if you have to. Do not rush the stub. So in summary, it is a legitimate fast-acting tool for mild to moderate ED, especially if you want to avoid pills. It's not magic, but used correctly, it's a powerful option. Dr. Freya Parkar is interested to hear your thoughts. If you had the choice, would you prefer a 10-minute topical gel or a pill that lasts longer? Drop your preference in the comments. And if you find these honest, hype-free medical breakdowns valuable, please subscribe so you won't miss the next one. Thank you for watching.